Now they call them therapeutic, but to me it wasn't therapeutic. It just made me better. Okay, I call that a cure.
So what did the president take anyway for this supposed cure to his COVID-19? He practically was skipping out of Walter Reed Medical Center just 3 days after he was admitted. To get more on this, I reached out to one of our go-to doctors, Dr. Geoffrey Baird with UW Medicine. He's a clinical pathologist. An interesting note, 60 Minutes used him in one of their COVID stories recently. The president was given 3 main therapeutics according to his doctors. Number 1, Remdesivir, which you've heard so much about. Number 2, Dexamethasone, a steroid. And number 3, the big one, Regeneron. It's a therapeutic made by Regeneron. It was also just given emergency use authorization by the FDA. It's a 2-drug cocktail. Okay, first, Remdesivir. It's considered a small molecule drug that mimics one of the building blocks of the COVID genome. Remember, the virus wants to replicate by hijacking our cells, and it replicates by following the COVID genetic code, which scientists actually know. Think about it with this visual. COVID is engineering more of itself, so it gets on the tracks to replicate by following that genetic code. When Remdesivir gets into the body, it mimics a portion of that code, and when the COVID train gets to the fake Remdesivir code, it derails the virus and it can't replicate, kind of poops out. There's really nothing that COVID can do at that point. President Trump also took what's called Dexamethasone. I hope I'm pronouncing that right. It's a steroid. Dr. Baird reminds us that when we're actually sick and we're showing symptoms, that's our body reacting to the virus and actually wreaking havoc on ourselves.
The symptoms we feel, like having a fever and having chills and having aches, those are actually due to chemicals that the immune system in our body makes. And those same chemicals can get made when we get a vaccine.
So when getting treatment, dexamethasone is given to patients to kind of calm down the immune system so the other drugs can work. Technically, this drug is only given to people with severe cases of an illness, so it has medical professionals believing that President Trump actually had a pretty bad case of COVID. And then there's the big one, number 3, President Trump was given Regeneron or Regeneron. It's made by Regeneron, so maybe you've heard it called Regeneron. We all know that when you get sick, your body makes antibodies to whatever you became sick with, so you can't get sick again in the future. So Regeneron is made up of a cocktail of 2 antibodies that bind to the spike protein on a coronavirus and inactivate it. The reason that they have 2 antibodies is if the first one isn't working so well, the second one can kind of swoop in as backup and get the job done and stop things. Bottom line, since you're not the president, at least I don't think you're the president watching, you're probably not going to get the same mixture of drugs that the president received. You're much more likely now at this point to get the vaccine.